It's finally November, and with that comes a new season. It reminds me exactly of last year when I first moved here, around this time, and how the autumn leaves were just slowly becoming more and more reddish brown from their orange and yellow colors. So we're basically in the late stages of autumn, and I think by Thanksgiving, all these branches are going to be completely empty of leaves, and then we're gonna get snow. Today I want to share my experience I had yesterday in shadowing in the ICU, and kind of like how that really helped me regain some of those skills and knowledge and appreciation of critical care medicine. You see, in the operating theater, nurses don't really use any clinical judgment or clinical medicine, any clinical assessments at all. It's really just more of a knowledge of the procedures and the instruments and the equipment that's needed, and really about time management in terms of when those things should be done, in the appropriate time frames, and also surgical sterility. So it's a very different world compared to the traditional nursing that I was taught in school when it came to critical care and really just the basics of hospital inpatient medicine. So when I went to the ICU, I was really surprised by all the drips and the pressors and everything that was just so fascinating as far as the eye can see, and the amount of knowledge those critical care doctors and nurses had, and even the surgeons, because yes, although they have to know about the surgery, they also have to know a lot about medical management. So it was really nice to see the surgeons' knowledge and just depth about clinical medicine and critical care medicine that they never shared with us in the OR, because there really wasn't a need for them to do so, I guess. It kind of shows a very different perspective on things when it comes to the continuity of care for patients. I learned a lot about prioritization, time management, medications, drips, ventilators, intake and output, line strains and airways, arterial lines, blood lines, catheters, chest tubes, all that you can name, and just how all of that has to be constantly monitored, along with the patient's vital signs, their heart rate, blood pressure, oxygenation status, respiratory rate, their central venous pressure. All those monitors an ICU nurse has to know, and when those things start to deteriorate, so that they can take the appropriate interventions, and whenever the patient is stable, they'll either be transferred to a lower level of acuity care or be released home. It really got those floor nursing skills back to me, and it's something that I really kind of miss and really enjoy, just spending those times either with one or two patients, just in that intimate setting, and really just being there for them, because the nurses are literally with those patients all the time, and the doctors are just kind of come in a couple times just to kind of give their input on what they think should be appropriate. So it's something I really enjoyed, and maybe in the future, if I'm able to go to med school and become a doctor, I will maybe consider critical care medicine. So that's what I did yesterday in the ICU. I shadowed from 7 in the morning until 3 in the afternoon, and then I took a break, about a 4-hour break in between, because I actually got called in to do 2 emergency surgeries. The first surgery was a anterior hip joint replacement, and the second one I wasn't able to do, but I helped set up. It was an emergency finger amputation for a DKA patient. So it was only there for maybe 2 hours, but I got the call during my lunchtime while I was rotating in the ICU about having to come to the OR. Luckily I was in the hospital, but I did actually get to spend some time in between just to plan out what the coming months are going to look like for me, and as well as just take a nice break in the cemetery. So there's a nice cemetery by Mount Auburn Hospital, and apparently it was America's first landscaped graveyard. That's what they claim. It was really nice and pretty, especially those autumn colors and how they reflected on the gravestones. It was just purely magical, and it kind of really gave me the idea that one day I'm going to be leaving this world, and where would I want to be buried? So it's it really kind of gives you that perspective from the ICU to the cemetery, and then going back to an emergency surgery, saving someone's life. It's like it repeats itself. That's all I wanted to share. I will certainly be keeping you updated. I have a lot of very fun things planned in the next coming weeks, and I will share those coming soon. Like I said in the past couple of videos, eventually it's going to come. So just stay tuned for that. Many thanks, and cheers.